Today we are giving away two things. We are going to give away one of these, and I'm going to tell you about it later. It's an amazing little peel pad that you can use. Great for getting ready for laser. So, and then the other thing, we're going to give you a getting skin ready, which is like a cleanser for your skin. So we talk about all these amazing procedures, but skincare is like
very important,
super important, super duper important. So we're gonna just chitty chatty for a little bit today. We're actually doing a live demo today. At the end, we're gonna walk into our office. You get a little tour, and I'm gonna do under my eyes. Actually, Amber's gonna do under my eyes for me. So you'll just get to see how quick and easy it is. I don't have any numbing cream on, so we're gonna do it. What do they call that when you're, let's see.
Well, she's gonna do it bravely.
Yeah, but
it doesn't hurt.
It really doesn't. That's why I can do it that way. And under the eyes is actually very sensitive, but it's easy.
Yeah.
Easy.
Yeah, it's gonna be very quick. So it'll be really nice. She's gonna get that tightening that she's looking for, and this will be your third.
I've actually done 3 on my full face,
Okay.
but I think the first one we didn't really get.
No, I
close to
wasn't
my
getting
eye,
close.
So that's why I want to do one more. This is my problem area, and I'll do another one in a month or 2 if I need to,
Sure.
because it just you can't really do too much of this laser.
No.
I always tell people just kind of, especially the under eye area, it's a little sluggish, and I say just keep kind of doing it until you get what you want.
Yeah, that baseline. Yeah, skin laxity is a big thing over there.
You look like a teenager.
Benjamin Button every day.
All right, so we're gonna get started, and please feel free to ask us some questions and give us some of your feedback. We want this to be, I wish you all were here with us. I want this to be very informal. And if you missed this, or if you know friends who wanted to come watch, they can get on Instagram TV, IGTV, and this will be posted in Instagram story for 24 hours and our Facebook story for 24 hours too. So, I've had a couple patients tell me, that's my dinner time, is when I'm in the kitchen cooking. So I think, they can watch it afterwards. It's up and there for all the information.
Yep.
We just want to keep everybody nice and educated and
informed. All the exciting things.
So first we always talk about what makes our practice special. Well, Amber's one thing that normally makes our practice special.
Oh, no, it's all you.
But she's going to be leaving us.
Oh, I know.
Yeah.
I think we get one more seminar.
We have one more seminar together.
Yes.
And then I'll have to Google her in. I'll do that.
Put me up here. Live from Connecticut.
Right, live from Connecticut. It's Amber.
Yes.
So, but what makes her special? Concierge.
Yes.
What else?
Yes. Well, yes, definitely the concierge touch. You come into our practice, you become one of the family. And also, Dr. Barrett has been doing this for almost 20 years. So everything that I've learned has come from my mentor and inspiration, my muse, Dr. Barrett. So even though I might be leaving to be dragged away to Connecticut by my husband, not bitter at all, you are in very good hands. And the nurse practitioner that's coming in to replace me also is a very, very skilled injector. You come in here, you're going to be greeted with a smile, with concierge touch. You're going to be made to feel like one of the family, and you're going to get a lot of education when you come in here. We're going to make sure that you understand what we've chosen for you and why we've chosen this for you.
I think it's super important. I mean, that's the reason we do these educational webinars, because there's so much out there, and I think there's a lot of people in the business that are honest and will educate, but I think there's a lot more that are just kind of in and out burgers. They're not right. They're going to use whatever they have in their office or whatever they need to move, and it may not be the best thing for the patient. So I think it's super important. We have a lot of different options, and we will fit everything to what you need. So it's really good. Can everybody hear us okay? us know if you can't. I think these microphones help a ton.
Yeah, for sure.
So today we're going to talk about our RENU Cool Laser, which is our amazing laser.
Yes.
You know, I've been doing lasers for 15 years. Fractional CO2 is the gold standard of lasers when you talk about treating lines, wrinkles, pores, pigment, tightening, you name it, scars, acne scars, that's the gold standard.
Yeah.
But, you know, we didn't have a lot of people, like everybody would get excited, oh my God, that sounds great. And then when they hear about the downtime, they would change their minds because the old-fashioned fractional CO2 dot laser was about 7 to 10 days of downtime to get a good result.
Mm-hmm.
And we just, you know, it's a busy world now. Most people
don't
find
have that, and if they have that, they want to go on vacation. They don't want to stay away from the sun living in South Florida.
Yeah.
You know, they want to go hang out by the beach.
Yeah, they don't want to sit at home and
hide
wait
away.
for their face to heal and look like a monster.
Right.
So in comes the Cool Laser.
Yes.
And
it's really just changed the game completely. So you come in, it takes maybe 10, 15 minutes. We can do face, neck, chest, hands, all the body parts that show any parts of age, even legs or arms, anything with crepiness or sunspots. And you're going to be read for, depending on the degree of aggressiveness of the settings, anywhere from 24 hours to 48 hours, and if it's maybe your second or third treatment, a little bit longer. But after 24 hours, you can go back to your daily life. So go back to makeup on, go back to wearing a mask, go back to playing sports, working out, going in the pool, golfing, everything that you enjoy living in beautiful South Florida.
yeah, and that's a big deal because with the old laser, makeup was only allowed after people peeled.
Yeah.
And it was at least a week.
Yeah, and they had to get like an antibiotic ahead of time.
Antibiotics and, you know, I called every day to check on them because, you know, it was, they would wake up in the morning and be scared because it looked like a monster.
Yeah.
This one, I mean, you know, that doesn't happen. It's like 1 to 2 days of a little redness and some swelling, but that's always a nice thing.
Yeah.
You know, swelling makes the lines go away.
Yes, true.
So,
this is true.
1 to 2 days of that, and the only reason people have to kind of stay home for 24 hours is
because they now can't wear a
with
mask.
COVID, right? Because you can't put a mask on after
Yeah.
for 24 hours, so we'd say stay home. Before that, people went out and about and they were fine.
Right.
But nowadays, with having to wear a mask, you know, it's different.
Right.
So it's really easy. I mean, it's easy, and for the results you get, it's amazing. So, you know, you go through that, you're gonna feel like sandpaper. Your face is not gonna look its best for 2 to 3 weeks. So, you know, it's not something you want to do right before a big event.
No.
You know, if you don't have to. I've had people do it before a big event.
Yeah.
Because they can put makeup on and be fine, but if you
A
want to
lot of
look your
moisturizer.
if you want to look your best,
At least 2 weeks.
at least 2 to 3 weeks before, and then the results are going to take about 1 to 6 months to be
See
seen.
the full result. Right.
So, and you know, it's great because the pain is minimal, the downtime's minimal, but something's got to give. So the other fractional CO2 laser was one treatment, but this one, you know, for a young person, somebody in their 20s, 30s, they can usually get away with one treatment.
Maybe 2 if they have pigment issues.
Right. But otherwise, you know, majority of us, we need to do 3 treatments, and they're done 1 month apart. But it's easy because the downtime is easy.
Yeah.
You know, I mean.
Yeah. They get it done on a Friday, take a half day from work, get it done on a Friday, stay in Saturday, and they're fine by Monday when they go back to work.
Yeah.
Not miss anything.
So it's a nice treatment. I would say the happiness factor is huge. When we post things on Instagram, we always put the happiness factor. I would say the happiness factor of this is like 99%.
Yes.
Which in the aesthetic field is huge. Because, you know, there's always going to be some people that fall outside of the curve. And
Right.
That happens with anything. Yeah. But very few in this one.
Yeah,
I mean,
very few.
It's really
Hard to displease them.
yeah, and the nice thing is people come in at like their follow up and they're like for their next one, and you see it when
We
they
put
come
the
for
side by
mine.
side pictures and it's like,
And the greatest thing is they're already saying, "Wow, I really see a difference."
or my husband does.
Yeah, so you know when that happens that when you put those pictures together, it's gonna be wow.
Yes.
Because nobody, you know, when it happens slowly like that, they don't
Yeah.
really notice the changes
Right.
usually.
Yes, true. Very,
So
very true.
it's really nice. So a very easy laser, I would say, out of all lasers, does the most
Mhm.
and has the
Best
easiest
results.
treatment, best results. I can't say enough about it.
Yeah.
I mean,
Game changer.
it is totally a game changer. Totally.
Game changer.
So, you know, I think that it's basically for everybody. Even a young, like 20-year-old wants to do it, and it's probably not a bad thing to do in
No.
your 20s
No.
because it's going to help stimulate that collagen.
Right.
At the end of your 20s, beginning of your 30s, as that collagen starts to
Perfect
die.
age to start.
So why not?
Right.
Yes.
So-
Question.
Angela Romanos says, I loved it. Can't wait for my next one.
Oh, perfect. Good.
Hey, Angela. Yeah, it's you know, that's what we hear from most people.
Yeah.
I love it. Can't wait. When can I do the next one?
Right. Right.
Because it's just like the results are so amazing.
Mm-hmm.
And it's really fun in this, you know, that's the one thing about RENU is I don't like to do things that don't work because, you know, who wants to deal with that?
No, who wants to deal with
People
it?
pay a lot of money and then
Yes.
if something doesn't work. So,
Right.
you know, but this one has like hit the nail on the head.
Right. Right.
So things that you're gonna do afterwards. What's the aftercare like? 'Cause
So,
there's always a little aftercare.
There's always a little aftercare. We're going to give you everything within the first 24 hours to go homeless. And we're going to reiterate that so that you understand what you're going to do. But basically, we're going to give you a cream from NeoCutis called Aftercare, and it's geared towards post-CO2 laser. So for 24 hours, all you're going to do is put on the cream that we're going to give to you. After 24 hours, you wash your face and put on some growth serum from AQ Growth Serum. It's got healing growth properties in it. You put that all over your face or your neck, your chest, wherever you got the laser done, and then sunscreen. Again, we give you the sunscreen, and what's nice is that there's even tinted sunscreen. So if you are a little bit red, that redness can be covered up. I actually really like the tinted sunscreen from Ulta MD. I use it just like makeup,
Yeah.
and it's
very hydrating.
it's so nice. Yeah, it's very creamy and nice, and it's perfect.
Yeah.
So another thing I want to add is we do sell packages post CO2 laser at a discount, which includes a hydrator called Hyalus, which is hyaluronic acid, and another sunscreen, Microday, and BioCream from NeoCutis. BioCream is my favorite moisturizer. It is very rich, and that is, my face just sucks it up because it's so dry, it just sucks it up. So this is a package that's sold post-treatment, but it's all of products that you can use every day, always, for the rest of your life, then you get a discount for, and you know, you made this investment on your skin. It's really important to keep up with good skincare.
So important. I mean, that's the thing. You know, a lot of patients are, oh, I did an IPL, oh, I did this, and everything came back. Well, if you
what are we
are
doing?
going to continue your lifestyle, which is in South Florida, you're usually
Fun.
out and about,
Yeah.
and you know, you're not going to at minimum use a medical grade sunscreen, and you're not going to use antioxidants, and you're not going to use things that stabilize your pigment cells. You know, then yeah, it is gonna eventually come back. So you've invested in this. You've got clear, beautiful, smooth skin. It's super important to invest in these products afterwards, or some good medical care product. So actually, with RENU, we just started our new skincare line, which is really nice.
Exciting.
I decided not to reinvent the wheel. We are using the same products, but we put them into nice little packages. So we have like RENU Skin Acne, RENU Skin Hydration, RENU Skin Pigment, RENU Skin Pre-Laser. We have all these RENU Skin packages. Everything's packaged up for you in a nice package price, and then you get your instructions, and it tells you how to use it. So it's great. So we've got a few questions. Yes.
Yeah, Tammy asks, I have very sensitive skin. Will healing take longer with the RENU Cool Laser?
Well, sensitive skin and healing is two different things.
Right.
So sensitive skin usually means that your skin maybe reacts a little bit. I have sensitive skin.
She's gonna say.
Right after the laser, I look like a red
Yeah, she's a little
tomato. I was super red. Amber and I had the exact same treatment.
She was fine.
Pink. I looked like
Fire engine red.
Yes. Went away really quickly, but my healing was great. So healing is just different. Healing is how rapidly your cells turn over, how good your proteins are, and things like that. So it doesn't necessarily mean you're going to have trouble healing. And the products that we give you, the growth factors, they help speed up that healing.
And the new acute aftercare.
Yeah, and we are available. We give you our cell phones. You can call us with questions.
Text us pictures.
Yeah.
24 hours a day.
We get you through. Because sometimes it's just a little bit of, oh my gosh, fearful that is this normal?
But it's okay.
Yeah. So usually think it's normal, and so I don't see that you're going to have a problem with healing. Great. So we had another question.
No.
Okay. Perfect.
Yeah.
So thank you. Keep your questions coming. And we actually do, if somebody wants to do a virtual consult, like today I just did somebody from Tampa. They don't, they want to find out about things before they drive 3 hours. So, we do these little virtual consults. We can FaceTime. We can let you know things. So you can call and book those with us. So our little laser is wonderful. We're going to show you some pictures. So usually Amber and I kind of talk rejuvenation, prejuvenation. Prejuvenation means that you're going to get things before they start. This is a rejuvenation. So you can see that this woman had some deeper lines and wrinkles, some more laxity, and you can see how much change she got from this. I mean, just really amazing, phenomenal. And I think this was after her second, she hadn't even had her third treatment yet, and she couldn't believe the difference. Look at the tightening around her eyes, even her jawline's looking better. It's almost doing some lifting. So really wonderful picture. This is me, just that tightening, and I didn't really have much in the way of pigment, but still the skin looks much more even tone and tightened, and around the eyes is where really it did a lot. This is one of my older clients, and she just had some nice smoothing, tightening. Right around her mouth is her difficult area, and she's just been super happy with this. And I think this was even just only after one treatment. So she's had 2 more since, and it's great. This is one of my very useful looking patients. Nice tightening, lifting, smoothing, brightening, just the whole shebang. I mean, and she's, I think this is after 2 of her lasers, and she's still got 1 more left. I think we did 2 because she had a regular laser in the past. And, she wants a little more under her eyes, so we're going to do that on her again. And now we're going to talk about some microtox. So RENU Microtox is a new treatment that we do, and it's a way to treat, let's say you didn't want a laser yet, you didn't want some downtime, you just want to get a little bit of instant glow, you want to have some smooth pores, and you want to just induce some collagen. So the microtox is a neat way to do that. So
Yes.
tell them about that.
And also, for a lot of the millennials that are having some problems with some superficial acne, because there's a neurotoxin or neuromod like Botox, Dysport, Xeomin in this, it goes so superficial into the dermis that it actually closes those pores and has been so beneficial for acne patients. So a lot of the younger generation likes to come in and get this. What you'll see is closed pores, help with acne, just glow and hydrated, glowing, really dewy skin. So it's been really nice. And also a really nice thing about this is that it's been known to last up to 6 months. So that's really, really, really nice. So
The other thing is the ease of it. It
oh
is
gosh, yeah.
pretty painless.
Very painless.
It's very painless.
Like
It's
nothing.
tiny, little
Teeny
needles.
2 milliliter, like nothing.
Nothing. And
Nothing.
the vial,
Yeah.
we mix our little concoction, which is like some kind of neuromodulator like Botox, and we dilute it, and which is a good thing.
Yeah.
Because you don't need much, and you want it very superficial and
Right.
spread out in the skin. We put hyaluronic acid in there, and then the growth factor serum. We mix it up, and then just boop, 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 and it's so easy because it's like you don't even feel the needles. I mean, they're
Yeah.
just teeny tiny.
Yes.
And immediately after, you're going to have a gorgeous glow. You're going to then see over the next 3 to 7 days, you're going to see your pores tighten, and over time that growth factor is going to stimulate your collagen. So it's like a win-win-win.
Yes.
And easy
Easy.
peasy. So that's something to do, again, like acne. Somebody has big pores, they've got an event they want to go to, and they just want to brighten up.
Oh, the neck bands.
Oh, neck bands are great with
Yes.
it. You can do your neck with it too.
Yep.
It's amazing. So our microtox is our little new thing we did, and
Yeah.
it's
It's
our
working really
little
nice.
concoction, and we love it. So here's another one of our lasers, and you can see the tightening under her eyes. And this is just to remember about hands. Really easy to do on the hands. So we have a little surprise, and we're going to go ahead and go treat under my eyes. Again, we're going to do the RENU Cool Laser right under here. We're going to, we can actually walk with our microphones, hopefully not trip. We can walk with our microphones, and we're going to head into the office, take you on a little tour. All right, so come on in.
Amber's got up her toe.
All right, here we go. I'm just afraid I'm going to trip over that. So this is our seminar area. We do cocktails and food in here. And got our gym going on over there. Beautiful fountain. Here, our waiting area. This is our little menu specials, but nobody sits in the waiting room anymore. We're super safe when everybody comes in. Now when we have patients come in, you come in with your mask on. You put your things in a Ziploc bag, you Purell your hands, and we bring you right back to your treatment room. So I'm going to lay down, and I'll let Amber do the talking for you. Our machine, and you'll get to see how quick this is.
Okay, guys, so this is my baby, my second born. I absolutely adore this machine. I love it so much. When you come in and see me, what you'll usually do is you'll numb in this room over here, and then I'll clean you off and then take you into this machine. It's on 3 and 600. Yeah, I'm just going to clean you off real quick.
Okay. Look at me, I'm trying to direct her.
I know, she's directing me. I'm like, wait, gotta clean you off.
You probably got enough light, right?
Yeah, it's whatever you want. So I'm just going to do this one area right here and her crow's feet.
So I'll be, with the eyes, you do get a little bit swollen. So I'll probably be a tad bit swollen for the next day or two.
And then you get some protective eyewear. Okay? Usually this goes, which is just a little vacuum, but I won't do it this time. What I'm going to do is I'm going to lift this up so I can see your eyelashes. And then I'm going to pull down. And 3, 2, 1. 3, 2, 1. 3, 2, 1. Good.
Easy peasy.
She's doing great, guys.
It just, to me, it feels like a cool spray. You feel heat, but it is a little bit of cool spray.
So one eye done.
Yay!
You see that? crease dye. Pull that down. Pull it all down. Get really close to that lash line.
Yay! That's it.
See?
Take goggles off. And there I am.
There she is.
Any questions? See how easy?
See how she's just a little bit red, but she's
Little
not
pink.
terrible.
And I get very pink, so. And it feels a little warm, and it's going to feel warm for about an hour or two. I'm going to just put a little bit, she's going to put a little cream on there for me. And that's it.
All right.
Okay, everybody.
Thank you so much
Thanks
for
for
tuning in to
watching.
us.
And we've got another one in 2 weeks. We'll be letting you know what it's about, and we'll show some pictures of my after in about 3 weeks. All right, take care, everybody.
Thank you. Bye.
Bye.
Do you want me to get some AQ?